Hi, I'm John Phillips. Recently here at PJTV, we released a new series called Keeping Your Gold in Your Golden Years. The series is available for purchase in the PJTV store. It provides you with key information and facts about retirement, Alzheimer's disease and dementia, nursing homes, wills and trusts, and so much more. It's basically a complete guide for your retirement. We've had a great response from you, our viewers, on the series. A few of you emailed us wanting to hear more about Medicare, so please welcome David Hogberg, who joins us from Washington, D.C. David is a healthcare policy analyst at the National Center for Public Policy Research. He's also the author of the book Medicare's Victims, How the U.S. government's largest healthcare program harms patients and impairs physicians. David, thanks so much for joining us.
Well, thanks for having me.
All right, so let's start right out of the box by asking the question, why did you write the book? What struck you to pen this particular tale?
Boy, that's kind of a tough question to answer. I've been at it so long, I kind of forgot what propelled me to do it. It was just initially, looking at all these commentators pushing for Medicare for all, saying how great Medicare was, and thinking, well, it's a government program, and all government programs suffer from many of the same problems, inefficiency, and so forth. So I just started digging into it, and I started talking to doctors and then patients about Medicare, and one thing led to another, and next thing I know, I'm in the middle of a book about it.
I originally went to school to be a political scientist, and I remember a friend of mine was getting a PhD in public policy who was doing a lot of research on Medicare. And we were talking about it one day, and he said, Medicare is a great program as long as you don't get sick. But when you get sick, that's when the problems start. I'm curious to get your thoughts on that opinion of Medicare.
Well, that's fairly close to the truth. In my book, Medicare's Victims, I define a victim as someone who, at least for a patient, someone who has either suffered some physical harm or loss of income due to Medicare's policies. And to understand who's likely to be a victim, I point out that you need to understand political power. By which I mean the ability to influence Congress on Medicare policy. And of course, there are many ways to wield political power, such as voting, obviously. I mean, if you can turn out millions of voters to the election booth, you're going to have a lot of sway over Congress. But there are other ways, such as organizing, protesting, campaign contributions, and so forth. However, Medicare's victims tend to be the ones that lack political power. And they tend to be among the sickest of Medicare beneficiaries. The reason being is that the sick people tend to lack political power. Number one, not that many people get seriously ill in a given year, so they don't amount to much at the ballot box. Second, they may be transient, which is kind of a nice way of saying that they may be so sick that they may not be around for the next election. And finally, if they're really ill, they're really in no condition to be, say, organizing, protesting, and so forth. That is, engaging in the kind of activity that is needed to push Congress to make changes in Medicare policy. So, once you get sick and you're on Medicare, it's quite possible to find yourself as a victim of a system that doesn't work very well for you.
If you could boil Medicare down to one fundamental flaw, what would that flaw be?
Wow. I think the most fundamental flaw is that it too often takes the decisions on medical treatment out of the hands of doctors and, most importantly, patients, and puts it in the hands of Congress and the bureaucrats at the Centers for Medicare and Medicaid Services. And this is done in a number of ways, but probably most broadly through Medicare's system of price controls, which have all sorts of unpleasant effects, one of which can be that you don't receive enough treatment. That tends to manifest itself in other ways among other ways, by encouraging physicians to spend less time with patients because, given the way Medicare pays for physician visits, you actually get paid more if you spend less time with patients. But it can also manifest itself by overpaying for certain certain procedures. In my book, I have a chapter on this, and I look at colonoscopy. Colonoscopies are probably, Medicare probably overpays for them. And as a result, some seniors, are harmed by this procedure. But that's basically the way that I think Medicare creates that inefficiency, is most broadly is with its system of price controls.
How about this? My grandma is 86 years old. She's been on Medicare, of course, ever since she turned, 64, something like that. If she gets sick, if she gets something really bad that happens to her, she gets some form of cancer, she gets some tropical disease, under Medicare, is she going to be treated by the best and brightest physicians, or is she going to be put in line with some substandard doctor?
Well, it would depend. I mean, if it's in the areas that seniors who actually do have a lot of political power, that is, for example, they vote at rates higher than just about any other group. They're very easy to organize since they belong to, senior centers and retirement communities. And so Congress does want to make Medicare policy that pleases as many seniors as possible. And if it's in the areas that seniors seem to care about, such as heart treatment, hip and knee replacements, and I think cancer, chances are she's probably going to receive relatively good treatment. But if she falls into one of the areas where, she's of a small group of people that are sick and don't have political power, such as possibly, let's say, Alzheimer's, then it can be far more problematic. I'll give you a quick example here from the book. The chapter on undertreatment looks at people who struggled to get physical and speech therapy under Medicare. Medicare has this, or had this standard on such therapy called the improvement standard, which meant that basically as long as the patient was continued to show improvement, Medicare would keep paying for the therapy. The idea being, you injure your hand, you want to get it back to its pre-injury state, and Medicare will keep paying for that as long as you're showing, movement toward that goal. Well, as often happens in medicine, physicians find new uses for old treatments, physical and speech therapy being one of them. And what they find is that with Alzheimer's patients, things like physical and speech therapy can help slow the decline of those patients. But slowing the decline, obviously, is not improvement. And I had one patient in there who needed speech therapy. She would go in, get some speech therapy, hit a plateau, so she's not improving anymore. The speech therapy would be discontinued. She would then decline, and then she would go back, and the doctors would say, oh, there's room for improvement again, and then she would go back into speech therapy. Eventually, Medicare jettisoned the improvement standard because it turned out that the improvement standard was not actually based on any actual law or regulation. It was just sort of a standard that Medicare had adopted over time. A group called the Center for Medicare Rights filed a lawsuit, and the Department of Health and Human Services agreed, look, we're not going to win this lawsuit, and so now Medicare does pay for things like physical and speech therapy for patients like Alzheimer's, for really any sort of legitimate medical need, not just for improvement. But, in this case, they got very lucky. I mean, when you think about Alzheimer's patients, are they in any mental condition to be engaging in the type of political activity that would have otherwise been needed to change the improvement
Right,
standard?
I guess the family has to step in.
In this case, they caught a break. But, given the way, medicine works, eventually some other treatment will come up that will help a small number of Medicare patients that Medicare doesn't pay for, and, they're going to be they're going to be stuck. Given the way Medicare works, it's almost inevitable.
All right, last question before we go. Bernie Sanders, a senator from Vermont who's running for president, has suggested that expanding Medicare for everyone would give us universal coverage and is the movement, the direction the government should be moving in. What's your take on that?
Well, the most interesting thing about proposals for Medicare for All is they seldom actually explain what it is that makes Medicare so great. In other words, what is it about the structure of Medicare that presumably makes it work so well? And, you know, wouldn't it really be good to know what that is, since presumably we could then extend it to healthcare programs, government programs that don't work well, like, say, Medicaid or the Veterans Administration, and, you know, get those programs to improve. But the fact of the matter is Medicare doesn't work. I mean, to the extent that it works, it has nothing to do with its structure. It has to do with political power. Seniors have a lot of political power, and if many of them start struggling with something about Medicare, it won't be long before Congress hears about it and is scrambling to do something about it. Unless you can somehow transfer the levels of political activity among seniors to the rest of the population, Medicare for All will not work. Those with political power, seniors, maybe the relatively well-to-do, would get most of the resources under a system of Medicare for All, whereas the politically less powerful would do far less well. And again, it's the sickest who tend to have the least political power, and so they would probably be the ones most likely to suffer under a system of Medicare for All.
All right, that's all the time we have for today. I want to thank David Hogberg for chatting with me. And of course, you can pick up Medicare's Victims online at Amazon.com, or if you prefer an ebook, you can download it to your Kindle. Also, be sure to check out our special PJ TV series, Keeping Your Gold in Your Golden Years. We'll cover topics such as how to care for a loved one with Alzheimer's, as well as how to create a will, and much, much more. The special PJ TV series is available in the PJ TV store. I'm John Phillips. For everyone here at PJ TV, thanks so much for watching.